I'm Dr. David Korn, Medical Director of LongLIfe Medical in Mesa, Arizona, and today I'd like to talk to you about cancer. Cancer is not a pleasant subject, certainly, but it's something we must address. And the main reason is because cancer is becoming something that's going to have and experience a 50% increase by 2030. On top of that, we've got the fact that nothing has really markedly changed in cancer therapy over the last 30 to 50 years. We're still doing about the same things that we always did. We're doing surgery, we're doing chemotherapy, and we're doing also radiation. But there has been a very dramatic increase in a process of the administration of the chemotherapy. It's called insulin potentiated chemotherapy. And I've been trained in that therapy, and I've been doing it now for just over 10 years. I've done thousands of administrations. And we have been able to couple that with a very unique protocol that we use at LongLIfe Medical that's giving us a very, very good number of remissions, even in patients that are stage 4. IPT was brought to America about in 1999 for the first time by Dr. Donato Garcia III, one of 3 physicians from a Mexican physician family who had been using it for approximately 68 years in Mexico with good success. I was in that first course given in the United States in Las Vegas, Nevada. I've been practicing medicine for about 30 years. My background is that first I graduated from dental school at West Virginia University in Morgantown, and I then joined the Public Health Service and right away began to take courses in oral pathology and the study of oral cancer. I started a program in early oral cancer detection in the state of Virginia, and other nearby states adopted that program. That led to and sparked my interest in more cancer understanding, and I had to go back to medical school for more. I went back to 4 years of medicine in Chicago, and then did medical internship in Chicago, rotating medical internship. And then I studied boards in homeopathic and integrative medicine, which amounts to the blending together of the best of all medical worlds. Traditional medicine blended with alternative and homeopathic medicine. I think people can best understand IPT with the following animation. Let's take, for example, a cube, which might diagrammatically represent a cancer cell. And let's compare that cube to a similar sized cube, which we'll call a healthy cell. So we're comparing a healthy cell on the right to a cancer cell on the left. Now you'll notice that the cancer cell on the left has multiple entryways into the interior of the cell. And these are called insulin receptors and or IGF-1 receptors. And they're just doorways or windows into the interior of the cell. And you'll notice that if you counted them, there would be 12 to 16 windows to the interior of the cancer cell. By comparison, the healthy cell only has 1 doorway into the interior. The cancer patient receives a dose of intravenous insulin, which drops their blood sugar to about, in 25 to 45 minutes, to a level of 35 to 45 glucose. But what really is important is at the moment of truth, which is the lowest ebb of their blood sugar, their interior windows and doorways are wide open, and they're screaming, "Sugar, sugar, sugar, we want sugar," because they're hypoglycemic, and that means low blood sugar. You must remember that it's been determined that anything in the midst of low blood sugar, anything that you give to someone, they're going to maximally absorb it at the lowest blood sugar level, because it brings about hyperabsorption at that point. So when we give rather than sugar, at that moment of truth, we give 10% of the standard chemotherapy drug for that particular cancer. And therefore, only about 10% of the chemotherapy agent will be distributed and preferentially to the cancer, because it has 12 to 16 times more windows and doorways than does the healthy cell, which you see only has the one. So only one unit, for example, gets into the healthy cell, whereas 12 to 16 times that amount gets into the interior of the cancer cell. This is a way to preferentially deliver the chemotherapy agent to the cancer. This way, there's very little side effects compared to traditional chemotherapy. So traditional chemotherapy will give you such side effects as hair loss, oral ulcerations, diarrhea, pain, abdominal pain and swelling, swelling of the legs and feet, profound fatigue, headache, and restlessness, sleep disturbances, and a whole variety of flu-like syndromes at the very least. Patients who receive IPT get very few side effects. We recommend about 24 treatments. They get 3 treatments a week, so there's a roughly 8-week treatment period. It's been estimated that about 95% of traditional chemotherapy patients are not able to complete the prescribed number of chemotherapy, whereas with IPT, patients very readily and easily complete the 24 prescribed treatments with IPT. IPT can be used for all cancers for which chemotherapy can be used, and that essentially involves most all cancers. If one is thinking about cancer and having it, I don't think that one has to necessarily believe that they're not going to make it through it or they're not going to be able to survive. With some of the therapies that we employ at LongLIfe Medical, including IPT and our localization protocol, I think that one can look forward to, hopefully, a normal existence and being able to beat cancer. That's the way that we all address your cancer at LongLIfe Medical. And we don't ever believe that you should give up or quit when it comes to cancer. But certainly if you have a question, don't hesitate to call us at LongLIfe Medical at 480-354-6700 and make an appointment to come in and see me, and we'll be happy to discuss your unique situation further. After all, it's your cancer and nobody else's, and only you can understand what dreadful circumstances that involves. At LongLIfe Medical, we really understand that, and we care about you there.
My name is Anna Davies, and in February 2002, I was diagnosed, after 4 months of testing, I was diagnosed with liposarcoma, which I learned at that time was about 0.02% of all cancers. Very rare, very hard to treat, and I am the longest living person with liposarcoma that I know of. So our hope at the beginning was not high, and I was told I might have 3 to 5 years to live, and here I am. When I first came to see Dr. Korn, I was very discouraged. I had been told several years ago that there was really nothing anyone could do for me. My only hope was clinical trials to try to extend my life for a few months. And we discovered IPT, which the low-dose chemo treatment that helped a lot. But the doctor I was seeing at that time was not very respectful of my opinions and myself as a person. And even though I was juicing and living an all-raw vegan life, I was being told that it was my fault that the cancer was still growing, and I was very discouraged. When I came to Dr. Korn, He and his staff treated me so professionally and respectfully and kindly. I felt very welcomed and appreciated the warmth that I received here. First of all, I was told that it wasn't my fault that I had cancer, and that we would, I told that Dr. Korn would do everything he could to help me. My husband and I had prayed a lot about where to go and what to do, and we felt very strongly that Dr. Korn could help us. One of the things that I had questions about in the past when I was doing chemo treatments was why the particular chemos that were being used. And I was told often, oh, it's just, you know, what the doctor said to use. And I really questioned that still, because I wasn't getting any better. And Dr. Korn he did tests to figure out which chemo would work just right for my kind of cancer. And in less than 6 months, I had the best PET scan that I'd had in over 9 years. There was no cancerous activity at all for the first time in 9 years, which was the hugest victory. And my kids feel like they still can keep their mom, and my husband has a wife, and I feel better than I have felt in a long time, also while receiving really good care and feeling very loved.